Peruvian people hold a special place in the heart of Dr. Cesar Jara. As part of medical mission teams of PAMS, the Peruvian American Medical Society, the Melbourne interventional cardiologist brings heart care to remote communities in his native Peru. Every year since 2007, Jara has participated in at least one of PAM's 26 annual missions to Peru. The Society has been working for almost 40 years to improve the health and the social and economic status of the people of Peru, says Jara. With PAMS, physicians such as Jara, as well as nurses, dentists, and paramedical volunteers, travel to Peru at their own expense, motivated by passion to help those in desperate need of medical care. In his last medical mission, Jara was even able to perform interventional cardiology procedures in the permanent mission PAMS has established in Lima. In previous missions, Jara has traveled with portable EKG and echocardiogram equipment to distant communities, such as the village of Cangalo in the province of Ayacucho. The area has a very large native population, says Jara, referring to the Andean native culture, also found in Ecuador and Bolivia. Last year, Jara traveled to Chincha, heavily affected by the devastating earthquake that struck southern Peru in 2007. Extreme poverty is a fact of life in these areas where regular medical care is basically non-existent. The hospital is a hospital in name only, says Jara. It doesn't even have an X-ray machine. Hypertension is common among the population, but the medicine, though only a couple of dollars in cost, is a luxury that people often cannot afford to buy. Jara brings the necessary medication so his patients can continue treatment after he leaves. According to the World Health Organization, cardiovascular disease is an emerging major issue in developing countries like Peru, so Jara's intervention is timely. This issue is starting to surface even in rural areas that are not too far from the large cities, says Jara. High cholesterol and diabetes are on the rise. There's an epidemic of heart disease, and we need to educate people now. At home, Jara volunteers in the faculty at University of Central Florida's Medical School and at Florida Tech. He has focused on getting the word out about heart disease to special populations such as African Americans and Hispanics, both groups with high incidence of cardiovascular issues. Jara walks the walk when it comes to volunteering. Grains of sand will eventually form a beach, so I do my part, he says. Ladies and gentlemen, your 2012 Central Florida Humanitarian, Dr. Cesar Jara.